There. Tom Bergstrom here with Dr. Terra Thomas, the President and CEO of HRDI, the Human Resources Development Institute in Chicago. And we're going to talk to her a little bit about her organization, her mission, and her relationship to a conference that's held every year called Counseling and Treating People of Color. Hello, Dr. Thomas.
Hi, how are you?
Good. Could you tell me the mission statement of HRDI and your relationship to the Counseling and Treating People of Color Conference?
Basically, HRDI is committed to serving what we call, our motto is serving the sickest and the poorest, but basically empowering families, individuals, and communities to become productive citizens. We deal with people who have fallen through the cracks, and our overall goal is to help them able to blend in with mainstream society. The next level that we're looking at, we predominantly provide treatment, but what we look at is that treatment is not complete until the person has not only recovered from alcohol or drugs or stabilized if they have emotional difficulty, but also have their education solidified, have their vocation solidified, and have permanent housing. And what we call is to having people take flight. So we deal with what we consider to be the primary phase of treatment, but the second and third stage of treatment is education, vocational training, and then permanent housing, permanent job. Then treatment is complete.
Do you deal with the black male prison population?
Oh, yes. In fact, HRDI has the largest inmate treatment program in the United States. If you know, Cook County Jail has about 10,000 inmates, and we have about a 500-bed resident facility, resident treatment program, and on any given day, we're serving upwards toward 1,000 clients who are currently incarcerated. Now, when I say currently incarcerated, some of them are what we call the day program, where they go home at night and they may be on an ankle bracelet. Sorry. They may be on an ankle bracelet, but we provide the treatment for them while they're incarcerated. And then we have a population of people who go out and work during the day and then come back. They're on work release. They go out and work during the day and then they come back, and on the evenings and weekends we provide treatment. And these are people who have usually on some type of drug charge. And as you know, about 85% of people who are incarcerated are on some kind of drug-related charge.
Are these people, would you say this population group is someone who that many of the other organizations are unwilling to work with?
I hesitate to say that they're unwilling to work with. I think that the populations that we deal with are ones who are difficult to work with. And the clients that we usually get are the ones that other folks may have a difficult time effectively treating or effectively being able to penetrate whatever their issues are and to help them to get to the next stage. So this is a very difficult population, not just the prison population, but just drug treatment, period.
Oh, okay.
If you would look at substance abuse treatment the way we look at business, the success rate in substance abuse is very poor, maybe about 35% recovery. Now, by corporate business standards, that would be dismal results, and a business would go out of business with those kind of results. But that's what we have in substance abuse, is about 35% recovery rate, and then about 75, 80, sometimes 80% recidivism rate, where people may fall off the wagon in terms of their abstinence, or people who, with the prison system, it's just like a constant revolving door. So some of the innovative things that HRDI seeks to do is to try and